Right now we're talking about living healthy. With the struggling economy, some people are more apt to put off medical care unless it's an emergency. I was talking earlier on the show that, sometimes us ladies especially tend to, put everybody else first and don't take care of ourselves. So, this morning we're not only talking about that, which I was talking about going for a checkup, getting a mammogram, but also when's the last time you went for a dental checkup, got the teeth cleaned, got that all checked out? Well, here is Dr. Catherine Lays from the Appleton Aspen Dental Clinic, and she's here to tell us a little bit about how important that is to get in there and get it checked out. Good morning, good to see you.
Good to see you too.
Are you finding that more and more you're getting patients who just haven't been there, it's been too long?
Yeah, no, and if you think about the oral cavity is the gateway to your body, so anytime you eat or drink anything, if you have active infection, it's going to be spreading throughout your entire system. I can't tell you how many new patients I've had who've come in because their orthopedic surgeon wouldn't put a new hip or a new knee on because they haven't had dental clearance yet. And if you have, let's say, gum disease, that bacteria, even though you're not having pain with it, that bacteria can spread to that new hip or knee and cause all sorts of problems.
Yeah, you don't really think about that. And get this, 75% of us have gum disease, and most people don't even know it.
Right, exactly. And if you catch it early, you can reverse it. When it's at that gingivitis stage, we can do localized scaling, localized antibiotic, clinical mouth rinse, and be able to reverse it. It's when it gets to that point where you have bone loss and where it's a lifelong condition where you have to keep treating it every 3 months or even lose your teeth.
Yeah, we don't want that to happen. Let's talk a little bit about people who wear dentures as well. I think people think once they get them, they're done. They don't have to go anymore.
Yeah, and
not true.
Right. And I really want my denture patients to come in at least once a year to get that oral cancer checkup. At Aspen Dental, we also do a Visalite. I don't know if I've talked to you about this in the past. It's a glow stick technology, and actually it hit kind of close to home. My husband, I found a small lesion using that technology. He went to the oral surgeon. The oral surgeon even had trouble finding it because it was so small, but it came back pre-cancer.
Wow.
So the key is to catch it early, and especially with my denture patients who only come in because their denture's sore or loose. Come in once a year just so we can check and make sure not only oral cancer, but they don't have any bacterial fungal infections that is very common with denture patients.
That you, like as we said, might not even know about, might not have any symptoms at all.
Right.
And as far as dentures go, that's something too that you do have to get new ones. You do have to get them replaced.
Yeah, the ADA says every 7 years, and every 2 to 3 years for a reline. Like I said, my patients usually only come in because, oh, my lower denture is loose or I'm having trouble eating, and you need to use them to be able to have a nice, balanced, nutritious diet. At Aspen Dental, we have 4 different types of dentures that we offer, as well as implants to secure those lower dentures in, which can be struggled. But even if you know you can't afford a new set of dentures, you should come in, have your dentist look at it. Like I said, make sure there's no bacterial fungal infection. Have it professionally cleaned at least once a year.
And the other thing we were talking about is it's not as expensive maybe as you might think. And also you have great hours. Some people are like, I just can't squeeze that into my day.
Right.
That's where Aspen comes in.
Yeah, late days. Tuesday we're open from 11 to 8.
Great. After work you can come. No excuses.
Yeah, absolutely.
All right, great to see you.
Well,
Thank you so
you
much.
too.
So now I've got the kids their checkups. Now it's time to get in and get mine for our teeth cleaning. Thank you very much. Appreciate it.